what type of cancer they had and where it was located, what was the cancer staging at the time of diagnosis, what chemotherapy they received, and be sure to include the doses and how many cycles they received. If the cancer survivor was on a clinical trial, if they received any radiation, and if they did, the survivorship care plan needs to include the dose during treatment and the total overall dose. This care plan also needs to include all of the medications that they received during treatment, such as growth factors, and the doses of any medicines the cancer survivor was discharged with. A survivorship care plan should also be portable, meaning that the cancer survivor can take this care plan and share with their other healthcare providers, like their dentist or their eye doctor. The plan should also be updated as time goes by. For example, if the dose of a medicine has changed or if the medicine has been discontinued, the survivorship care plan can be updated. As a nurse practitioner, when one of my patients gives me their survivorship care plan, I now have a concise record of all their cancer treatment and any medical issues that I need to be on the lookout for. It's an easy-to-follow list of what to do and when to do it. And one of the best reasons for patients to have a survivorship care plan is so they will know what their side effects are totally normal. Patients are relieved that when I tell them that I'd be surprised if they weren't tired or having problems sleeping or even experiencing the fear of recurrence. Patients want to know that these feelings after cancer treatment are normal, and they want to have a plan for how to deal with them. This knowledge is priceless. Also, I can use their survivorship care plan to help me guide their health care in their new normal. These plans can offer patients a sense of relief, and it gives patients the skill to help them navigate the what next portion of their life. Survivorship care plans allow cancer survivors to live life to the fullest after cancer. And as the number of cancer survivors continues to increase, ongoing evaluation of the long-term and late effects of cancer treatment will continue to be an important role of all healthcare providers. Survivorship care plans are one way that healthcare providers can help survivors begin to develop health-related quality of life goals and to define their new normal. Empowering survivors to engage in self-care and wellness activities such as eating a healthy diet, regular exercise, and other mind and body programs is essential to improving the overall health and well-being of all cancer survivors. Thank you.
Thank you so much.
Jill. Oh, sorry, Lindsay.
Sorry. Go ahead. Just thank you so much, Jill and Lee, for articulating why care planning is so important. As they both explained, there is great value in cancer care planning, but unfortunately most patients don't receive care plans, so that is why NCCS has been working with Congressman DeSaulnier and Congressman Poe on bipartisan healthcare legislation that would establish a new Medicare reimbursement code for cancer care planning. So this bill was just recently introduced in the House on March 5th, and it has not yet been introduced in the Senate, but we are currently working on finding co-sponsors for the bill on the Senate side. And so I wanted to just take some time today to explain what the bill does and how you can help us ensure that it is passed. So Jill and Lee explained why care planning is necessary, and I know many of you understand the value of care planning, so I just wanted to reiterate why there is a need for this legislation. In several evaluations of the cancer care system, the Institute of Medicine, which is now called the National Academy of Medicine, found that cancer patients rarely receive a care plan. And the Academy said that patients should receive a care plan because the planning process really triggers a solid treatment decision-making process, and it facilitates the coordination of treatment and supportive care that includes management of nausea and vomiting, fatigue, anxiety, and depression, and all those important pieces that Jill explained. And so after patients finish active treatment, they may transition into a different system for survivorship care. And these patients require monitoring of their effects of their cancer treatment and for cancer recurrence, as well as the follow-up care following like recommended schedules that their provider provides them. And a written care plan facilitates the transition into survivorship care and that ongoing care that's required after that. So this is a great graphic that I think really illustrates the difficult process of diagnosis, treatment choices, treatment management, and a written plan or roadmap would really help promote shared decision-making between patients and their care teams throughout this difficult process. And I recently came across a great quote about care planning, and I think it really explains the importance of care plans. And the quote is, "Pilots don't take off without a flight pattern, and architects don't break ground without a blueprint. Patients diagnosed with cancer are taking the journey of their life, literally. So the role of the cancer treatment plan in starting a conversation and promoting comprehension and retention and managing expectations and anxiety and providing continuity across settings and episodes is so important." So we're really grateful to have more than 40 organizations and cancer centers endorsing and supporting the Cancer Care Planning and Communication Act. And this slide just lists all of those organizations. Okay, so now we know why we need this legislation and how it would help cancer patients. So I'm just going to take a few minutes to talk about how we can all work together to get this bill passed. So calling your member of Congress is one of the easiest and most influential ways to communicate on the CCPC Act. And when you get connected to the office, ask for the staff member who covers health issues, and mention your connection to cancer as a survivor or a caregiver or provider or family member, and stress the importance of care planning and coordination, and ask their boss to support H.R. 5160, the Cancer Care Planning and Communications Act, to help ensure that every Medicare-eligible cancer patient has access to a care plan. And NCCS has a hotline number that will direct you to the office of your member, and it's really easy to use. The number's right here on the screen. You can also visit our website, and we have a constituent messaging service, and you just simply fill out the form with your name and address, and a letter will be sent directly to your member's office asking them to support the bill. And if you already have a relationship with your member of Congress, either in the D.C. office or back home in the district office, then you should contact the person that you know directly to ask them about supporting this bill. And NCCS is happy to help you set up meetings in your district offices. And so if you're interested in doing that, just feel free to send me an email. My email is lhouse@canceradvocacy.org, and my email will be at the end of this webinar. And it's also helpful if you're able to share posts on social media about the legislation and about care planning, and ask your friends and family to also contact their members of Congress. We have several resources available on our website to help promote the legislation and support your efforts in advocating for the Cancer Care Planning and Communications Act. We have a great one-pager that you can take to in-person meetings. We have sample care plans available. The webpage has the forms where you can send your member a letter that I mentioned earlier, and the hotline number is there as well. And NCCS is developing a Cancer Care Planning Communications Act toolkit that will be included that will include these talking points and all of the other information to help you connect with your members' offices, and that will be available soon on our CCPC Act webpage. And so that is how you can help us make sure that this legislation is passed and to positively impact cancer care and make sure that all eligible patients have access to the care plans that they need. So now we have a couple minutes for any questions. And if you are able to put your question in the chat box, we will try to answer them as best we can. And we have a question, should we also be contacting our senators or just our congressmen at this time? That's a great question. So right now, the bill has only been introduced in the House. And so our priority is targeting representatives and House members. So first do that, but we will be introducing in the Senate soon. And so if you want to go ahead and contact your senators and let them know that it has been introduced in the House and to expect it to be introduced in the Senate soon, or if they would be interested in sponsoring, co-sponsoring the bill on the Senate side, you can certainly ask them to do that, and that would be helpful. But right now we're focusing on the House side. And we have another question, how can we get a copy of this presentation? Yes, this presentation is being recorded, and we will send this out after. We have another question, how can my organization get on the list of endorsers for the Act? That's wonderful. We would love to have more endorsements for this bill. So if you could just email me at my email that's on the screen right now, lhealth@canceradvocacy.com. We would be so grateful to have your support, and we would love to add you to that. We have a question, is this focused only on Medicaid patients or all patients and providers? So this is specifically a Medicare reimbursement bill. So right now, it's just focused on Medicare eligible patients, and it would impact them. And a question, we have a question for Jill. In the list of what the survivorship care plan should include, what was the item after care team and contact info and before staging?
Let me find that. And that was towards the beginning. How to contact your care team, and then what type of cancer you had and where it was located. So if you had a solid organ type of tumor, where it was located. What the cancer staging at the time of diagnosis was. If there was chemotherapy that was given, and then how many doses, or include the doses of the chemo and how many cycles.
And we have another question. Does this bill encourage cancer survivorship programs to assist in facilitating survivorship care? Yes, it absolutely does. And if this bill were to be passed, then it would provide a new revenue stream, so it would really encourage providers to facilitate the survivorship care plans, and they would get adequately reimbursed for doing so. So I think it absolutely encourages programs to do that.
And this is Shelley. I'll just add that the Commission on Cancer, which accredits hospital-based cancer programs, has made survivorship care planning a requirement. So a lot of cancer centers are doing this because they have to meet the Commission on Cancer requirements, but some are struggling to meet the requirements, in part because it takes more time. It's not as easy as you might think because it's pulling information from different sources. There are some software tools available to help people create survivorship care plans, but it's still some kind of behind-the-scenes time that it takes for usually a nurse practitioner or someone at the hospital to create this. So the Commission on Cancer and many of its programs have been very supportive of this because it would better reimburse them for their time to do this. That's something that they're trying to meet this requirement, but it's been challenging for them. And Lindsay, if you don't mind, I'll take a couple of questions too. So one of them is, should I use my cancer story as part of contacting your congressman? Yes, definitely. I think it's really important to talk about your own story, and you can talk about if you received a care plan, how that helped you navigate your journey and why everybody should get one, or if you didn't, why that might have been helpful for you, because it is such a challenge to navigate the cancer diagnosis and treatment and then survivorship. And so I think that, either way, whether you received one or not, using a short version of your story is very helpful. One of the things that we've done in some of our in-person trainings is a little class on sharing your story in a nutshell, like the 2-minute version. When you're talking to your member of Congress staff, you're not going to have a long time to share kind of the full version of your story, but learning how to share the short version of it and connect it back to the legislation is really important and very helpful, and I think we have some resources on our website that could help you with that. There's also a question, is it considered a one-time reimbursement or ongoing reimbursement for each time the plan is reviewed? So there are the legislation describes the times when this could be applied, and it's at diagnosis, if there's a major change in the treatment course, and then at the transition to survivorship. So I think some of the details about exactly how that would work would be part of the rulemaking process if the legislation passes, and then the Centers for Medicare and Medicaid Services has to actually implement this and create the Medicare code. But it's allowed at more than one time, but it's not like a monthly kind of thing or every time the patient would meet with the care team.
And Shelley, do you want to answer the question about the standardized care plan?
Yes. Can you read that to me? I'm
sure.
Sorry. I'm
it's will this be a standardized care plan that would be the same for everyone so that it is consistent should the patient change doctors or move?
So the legislation does not specify what care plan would be used. And when we talk about this with providers, there's a lot of pushback on this. Is this a requirement, or people telling me what kind of, what form I would have to use? Does not specify a standardized care plan. I think that, again, as CMS, if legislation passes, as CMS creates a code, they put some parameters on what you have to do to get reimbursed for it. So they might have some minimum elements that would need to be included, but it wouldn't necessarily be one standard care plan because there are so many out there in use, and I don't think that CMS wants to be in the business of saying which one is the one that should be used, and wants to make sure that providers have the ability to use what works for them. But there may be some kind of minimum standards that would be required. So it isn't that. I think that's one challenge, though. It isn't consistent as patients change doctors or move from state to state. But I think that it would be very difficult to get providers to agree to a single format for a care plan.
We have another question. Which specific providers should be responsible for initiating the care plan?
There's multiple providers who could do this. So if your main treatment was radiation therapy, then your radiation oncologist could be the one to do this. If your treatment includes multiple doctors, then I think there would have to be a conversation to see who's the one who's really sort of driving the train to create that care plan. So it is not specific to only medical oncologists or radiation oncologists could do this. And I think, again, that would go to the parameters that CMS would set as they created this code and actually put together, what you have to do to get reimbursed for it.
Okay, another question. Is there a plan within the CCPC that private concierge-type organizations who navigate the complexities of cancer for patients, including long-term planning and clinical trials, be reimbursed? And I think you sort of answered that with the last question about providers who can initiate the care plan.
Yeah, I mean, I think if you're eligible to be, if an organization is eligible to bill Medicare for the service and meets the requirements that CMS puts out, then they could. But I mean, it doesn't change who can bill Medicare and how you bill Medicare. So if an entity is not able to bill Medicare, then this wouldn't create that for them.
And there were two similar questions asking, is there any information included in this bill for those patients who are excluded from care plans in their care, and is there still an opportunity to catch up with these patients?
I don't think that there's any reason you couldn't go back and get a survivorship care plan after the fact. I mean, a lot of times those survivorship care plans are not created and delivered to the patient until well after their treatment is completed. So I don't know that patients who didn't receive one and wanted to go back and get one would necessarily be excluded from this. I think you could. I also saw a couple of questions about how has this been received by members of Congress and if there are any who are opposed. So generally, this legislation has been introduced in past Congresses under a different name, the Planning Actively for Cancer Treatment Act. And basically, our experience has been when we talk to members of Congress about this, it sounds like a good and reasonable idea. Nobody is, opposed to it. You can usually talk through questions that people have. It's more a matter of getting them motivated to take action. And they don't do that unless they hear from their constituents. So it's not a controversial or contentious issue. I think you do always have, people ask about the cost. We don't have an official score, and we don't know exactly how much it would cost. So I think that's always a question when it comes to some members of Congress. I think it definitely helps to be able to say this is a bipartisan initiative that, it's being introduced by two cancer survivors who are members of Congress and one who is a Democrat, one who's a Republican, so that helps. You should definitely call any member of Congress. Again, there's no one who's specifically opposed to it. It's more just getting them to pay attention to it because there's so much else going on and it's an election year. But I think, one of the things that we're focusing on when we talk about it on the Hill is that it's a bipartisan health care initiative. And there's just, unfortunately, not a whole lot of bipartisan work being done in Washington right now. And so I think that's, a little bit of a selling point for it. But really it's just a matter of getting it in front of them and making them understand why it's important to patients. It's just something that's not really on their radar. And the only way to get it on their radar is to have their constituents and cancer survivors bring it to them and say, this is important to us. And see, have we answered all of the questions?
I think so. One last, okay. Oops. If the bill passes, resulting in the process of creating a care plan being a billable service, followed by CMS setting up parameters, how long does it customarily take for insurance companies for non-Medicare patients to follow suit and make it a covered service?
That's a very good question, and I don't have an exact answer. It's not. I don't think there's a. It's 6 months later this will be covered by all insurance companies. But I think the reason that we've focused on Medicare is because it is a place where you can get Congress to act, for one thing, and because Medicare covers such a large percentage of cancer patients. And so you can, affect many cancer patients through Medicare. And then because, oftentimes the private payers will follow Medicare's lead on covering certain types of services. But it's not a guarantee and there's not a defined time frame. It's just something that we would continue working on to try to make sure that everyone has access besides not just people with Medicare. And the question, is there a budget impact? There would be a cost to it, but we don't know exactly what that would be. Now, there's a potential that care planning could potentially save money by, having better coordinated care, reducing duplication or elimination of additional testing and services like that. But we don't have hard data to prove that. So we just think it's really about delivering good care to patients and the kind of care that patients need. And we know that, through the oncology care model that the Centers for Medicare and Medicaid Services is testing with about a little less than 200 providers around the country, this is a requirement. So Medicare has recognized that care planning is important and requiring the practices that are participating in this demonstration project to do care planning as part of their participation in this program. So we just want to make sure that all Medicare patients have access to care planning, not just the ones who happen to go to one of these practices that are participating in it. So they have included it as part of their model because they think that it will lead to better patient care and could potentially help with saving money on unnecessary care, while we don't have the data to prove that yet. There's one question: does it matter how many years a person's been out of treatment to get a survivorship care plan? I think that you can, even many years after treatment, you can go back and ask for one. I've heard stories of patients who, because they may be treated as a young person living at home with their parents and then move to another part of the country and now have to manage their care and don't even know what their treatment was when they were, a teenager, who then sort of spearheaded the process themselves of getting a care plan to be able to really manage their own care. So I think it's something you can always go back and reconstruct, even if it's been years afterward. There are tools to let patients create their own version of a care plan. NCCS has been a partner in the Journey Forward project with a number of other organizations over the last about 8 years. And Journey Forward is a tool that allows providers, it helps providers to create a care plan, and it makes the process a little bit easier. It's a free software that any provider can use and download, and the sample care plan that we have on our website was created through Journey Forward. Journey Forward also has a tool called My Care Plan, which is for patients to really create their own, and it's more work on your part if you have to go back and sort of reconstruct all of the things that that were done as part of your treatment. But it's something that you can do if you think that would help you in coordinating your care moving forward. And there's other tools out there to help patients create their own. We just don't think that burden should be placed on patients to have to do it, but I think it's helpful to have tools out there for patients who want to if they didn't get one and can't get one through their providers. And there's also a question, will we be pushing this out through various social channels, and can you provide social posts we can use? Yes, we can absolutely do that. We have been putting it out there on social media, but I think we will also, because we have so many partner organizations that are supporting the legislation and want to help, we will be creating some sample posts and social media content that you can use and customize for your patient population if you want to share this, and we appreciate the help. You all are asking great questions. This is good. Sometimes we have a webinar where you really don't get many questions, so thank you very much. It's exciting to have a lot of people participating and the interest to ask good questions, so thank you. And so the question is a provider who completes the care plan, or do they actually complete it with the patient? I think generally the providers do create it. There may be, depending on the provider, they may have room or spaces for patients to add their own comments or add their own thoughts. But generally, it's created, especially a survivorship care plan, is the combination of what has been done as part of the course of treatment, and then what are the recommendations for the patient to, for future surveillance and health promotion and just, healthy habits and things like that. So the provider puts all of that together. I think that in creating a care plan, it does require that conversation with the patient, so the patients are involved in that way, because it is really a process and having the discussion and not just a piece of paper. And I think that's been a big, point of discussion around survivorship care plans, because it's not just about handing someone a piece of paper. It's about having the discussion with them about what this means and how that they can use this to take an active role in their health care. So in that sense, the patient's involved, but it's usually the provider who's actually completing the written plan that is provided to the patient.
I also wanted to mention another way to get involved with care planning and other cancer policy is our Cancer Policy and Advocacy Team. It's a program for survivors and caregivers to learn more about policy issues affecting cancer care and be engaged as advocates in public policy around the needs of survivors. And our CPAT, really provides tools and training that build upon your personal with cancer so that you can become an effective advocate to work with us to improve cancer care and promote important legislation like the Cancer Care Planning Act. And so if you're interested in learning more about the Cancer Policy and Advocacy Team, the CPAT team, just contact Kelsey Napote. It's KNEPOTE at canceradvocacy.org. You can contact me as well, Lindsay House.
So with that, I think we can wrap up. Thank you all so much for participating. Thank you very much to Lee Jones and Jill Beavers-Kirby for sharing your experience both as a patient and as a provider. I think you really gave us a great context for why this is so important. And I want to thank all of the NCCS team for pulling this webinar together, and thank you for your patience with us as we navigated our new technology. I think it worked out in the end, even though we were a little unsure at the beginning. I was talking and wasn't sure if you all could hear me. So thank you very, very much for participating, and please be in touch if you have questions, and we appreciate your help in advocating for this important legislation.